Hello, welcome to Fogwing Learning Center. Today we will be discussing about preventive maintenance in healthcare, enhancing safety and efficiency. Let's jump right into it. Preventive maintenance in healthcare, enhancing safety and efficiency. In the healthcare sector, where equipment reliability can directly impact patient care and safety, preventive maintenance, PM, plays a crucial role. Preventive maintenance involves regularly scheduled inspections, servicing, and repairs of medical equipment and facilities to ensure they remain in optimal working condition. This proactive approach helps to minimize the risk of unexpected equipment failures, which could disrupt operations, delay treatments, or even jeopardize patient health. The importance of preventive maintenance in healthcare. Ensuring patient safety. Medical devices such as ventilators, defibrillators, and diagnostic machines are essential to patient care. A sudden malfunction of these critical devices can lead to life-threatening situations. Regular maintenance helps identify potential issues before they cause failure, ensuring that healthcare facilities can provide uninterrupted, high-quality care. Compliance with regulations. Healthcare facilities must adhere to stringent regulatory standards and safety protocols set by governing bodies like the FDA, Joint Commission, and ISO. Preventive maintenance ensures that equipment meets these requirements, helping hospitals avoid penalties, legal issues, or accreditation risks. Cost efficiency. A proactive maintenance strategy helps to reduce unexpected breakdowns, which can be expensive to fix and may result in costly downtime. Regular maintenance extends the lifespan of medical equipment, lowering the need for early replacements. In the long run, preventive maintenance can significantly reduce operational costs. Optimized equipment performance. Medical equipment that functions at its peak ensures accurate diagnostics and efficient patient care. Preventive maintenance involves calibrating and fine-tuning devices to maintain their optimal performance levels. This not only improves clinical outcomes, but also enhances the overall efficiency of healthcare delivery. Minimizing downtime. In hospitals and clinics, operational disruptions due to faulty equipment can result in the rescheduling of procedures and delayed care. Preventive maintenance schedules equipment servicing during off-peak times, minimizing downtime and ensuring the facility operates smoothly. Key areas of preventive maintenance in healthcare. Medical equipment. Diagnostic devices, patient monitoring systems, infusion pumps, and surgical tools all require regular calibration and inspection. Biomedical engineers and technicians use preventive maintenance programs to monitor wear and tear, calibrate sensors, and replace aging components. Facility maintenance. Healthcare facilities must ensure that their physical infrastructure, including HVAC systems, plumbing, electrical systems, and elevators, is in optimal condition. Preventive maintenance in these areas is crucial to maintaining a safe and comfortable environment for both patients and staff. IT systems and software. With the growing importance of electronic medical records, EMRs, and other digital healthcare tools, maintaining IT infrastructure is vital. This includes ensuring regular software updates, securing data, and protecting systems from malware or technical glitches. Implementing a preventive maintenance program. Asset inventory. To create an effective PM program, healthcare organizations need a comprehensive inventory of all their medical equipment, facilities, and IT systems. This helps in tracking maintenance schedules and equipment conditions. Risk-based prioritization. Not all equipment requires the same frequency of maintenance. Healthcare facilities must prioritize maintenance based on the criticality of equipment to patient care and the likelihood of failure. High-risk devices should be inspected and serviced more frequently. Scheduling and tracking. A well-planned preventive maintenance schedule ensures that maintenance tasks are performed on time. Maintenance management software can help automate scheduling and track service history, providing real-time updates to the maintenance team. Documentation and compliance. Keeping accurate records of preventive maintenance activities is essential for regulatory compliance. It provides a clear audit trail and helps healthcare facilities demonstrate that they are adhering to industry standards. Challenges in preventive maintenance. While preventive maintenance is essential, healthcare organizations face challenges in implementing it effectively. Budget constraints. Allocating sufficient funds for regular maintenance can be a challenge, especially for smaller facilities. Workload balance. Coordinating maintenance activities without disrupting patient care can be complex. It requires careful planning and communication between departments. Technological advancements. The constant evolution of medical technologies means that maintenance teams need ongoing training to stay current with the latest equipment and protocols. Conclusion. Preventive maintenance is an integral part of healthcare facility management. By proactively maintaining medical equipment, IT systems, and facilities, healthcare providers can ensure better patient care, reduce operational risks, and comply with regulatory requirements. A well-structured preventive maintenance program enhances the overall efficiency of healthcare delivery, protects patients, and safeguards hospital investments in technology and infrastructure. Learn this video. Helpful, don't forget to subscribe to our channel for more informative content. For more details, visit our website, fogwing.io. We're looking forward to see you until then. Take care.